We've all realized the new role that telehealth has in the complex rehab industry, but as providers who work with clinics, PT, and OT offices all the time, how can we promote the benefit of telehealth to them while strengthening our relationship and serving the patients? You know, today we have a real honor to be joined by Mr. Joe McKnight. Joe is an assistive technology professional. He is a RESNA certified seating and mobility specialist, and he is a NART certified rehab technology supplier. Joe, welcome, my friend. We are really honored to have you with us today.
Thank you, Ty. It's a privilege to join you. Thanks for having me.
My pleasure. Thanks. So, Joe, first, let's kind of give some context to our listeners. I know I gave a little bit of your background. Why don't you kind of embellish on that a little bit? We've known each other a long time, so I'll let them know if you've gone off track on that. Okay.
Absolutely. So I started training as a nurse and paramedic many years ago in the early 80s at Deaconess and St. Mary's in Indiana. I worked in clinics. I have owned and managed home medical equipment companies throughout the years. I've been teaching and presenting in the field of rehab and complex rehab for many years, worked with many societies, including NARTS and RESNA. Work now with ATLAS Enterprise Software and with Telehealth Clinical Evals and the ACES software system. So it's been a great privilege to work here.
Yeah, very diverse background and very capable of speaking about our topic today. So tell us, ACES, which let's provide this for everyone listening, stands for ATLAS Clinical Evals Software. Tell us how ACES came about, if you don't mind.
So we recognize that there's a growing need to have a platform where ATPs and therapists can have a structured and secured mechanism for clinical evaluation of patients and their equipment needs. The ACES software platform promotes a HIPAA secure, compliant, and collaborative environment for physicians, therapists, nurses, assistive technology professionals, and other healthcare professionals to operate together as they focused on the best outcomes for their clients.
And it has been working now. How many months have we been doing this now, Joe?
Oh, goodness. Now I believe we're probably now right at about 8 months, maybe a little bit longer.
8 months into it. And I think you're right. I think it's right about that time. So Joe, as an ATP and as you mentioned earlier, a former provider, how do you see ACES benefiting the various clinics that a CRT provider would be serving today?
You know, Ty, I think the phrase that Bill Paul, our CEO, uses is the future belongs to the efficient. And as we recognize that reimbursement shrink, clients' needs increase, medicine in general becomes more specialized, demands from payers increase, this tool allows a clinic to become efficient in assessing their clients, documenting those clinics' needs and the client's needs, providing the necessary information rapidly to the providers so that equipment, technologies, and care can be provided efficiently for them. We can actually change the evaluation to delivery timeframes and dramatically reduce those. Clinical excellence also is something that we're striving to work on to enhance the practitioner's abilities along certain workflow pathways and making them thoughtful so that the best technology choices are provided to the patient and those resolutions.
You know what resonates right there with me is the workflow pathways that are thoughtful. I mean, we've really come a long way, and who would have thought telehealth and now ACES and the eval capability that we have there would be one of the things on the forefront of us really being able to change those workflow pathways. I'm so excited about this and encouraged about it. So I see the benefit. And it's tremendous, no doubt about it. So have you seen providers and have you talked with them, and have they been able to approach clinics with this opportunity? And can you share with us what they find as maybe their financial requirements to get engaged with this?
So there is a means by which there's a subscription service for the ATPs to utilize this software. It allows them to complete the ATP paperwork that is necessary and the home evaluation. There is no charge to the therapists or the clinics who are involved in the process, but it does provide that avenue for them to complete their paperwork efficiently and get that done in significantly reduced timeframes and with concise, efficient systems.
That's amazing. Joe, what have you observed? Because I know you've been doing this for a while now. What have you observed from the clinic's perspective and the benefits that they have realized by using ACEs?
Well, I define it in 3 words. We look at efficiency, comprehensiveness, and compliance. When clinics use the ACEs software, the evaluation of the client is completed rapidly. The paperwork is done correctly the first time, so it doesn't have to be sent back for repeated corrections, and is compliant with the rules and guidelines of the payers, especially Medicare and the state Medicaid agencies, which have very specific rules in the way that things have to be done.
Wow. Joe, I know we're really just scratching the surface with this, and this has been very, very informative time, and it's really packed full of a lot of terrific application for both the CRT provider and the clinic. So I want to thank you. But Joe, how does a CRT provider get this amazing offering into their hands, and then obviously into the hands of the clinics that they're working with?
It's quite simple, Ty. We can be reached. You can call me at my office number, 702-425-3854. You can email me at jmcknight@atlas-view.com, or just visit our website at www.acesevals.com and take a look at it. It runs you through the website, and it'll let you know what we can do and how we can help you.
Yeah, and we'll make sure that we put that information up at the end of the podcast with the email and everything else like that, and when we launch this on social media as well. So any final words or comments that you'd like to mention to our listeners today, Joe?
Just one more, Ty. Yeah, if you go to that acesevals.com website, we have a link that tells you how to get in touch with our training systems for both the therapists as well as the providers. You just click on the link, and we do those trainings weekly throughout the month. You can go ahead and click on that link. They're free of charge. We encourage you to go ahead and utilize those.
Oh, Joe, thanks so much. This has really been informative. I appreciate your time. I know it's valuable. I know you're on the phone constantly with doing ACEs, doing evals with folks and helping them. So friends, we will be doing an additional podcast, I know, regarding telehealth and ACEs. So please stay tuned for that. And until then, take up Joe on his offer, make a phone call to him, send him an email, take a look at the acesevals.com website and see how this amazing offering can benefit you and also the clinics and PT and OTs that you take care of. Joe, thank you again. Have a great day.
You too, Ty. Thanks so much.